Hey folks, today is Saturday, April 25th. Hi, Pathlight community, Ruth Banta here. You can see I am outdoors, so you may hear some cars, you may hear some birds. I hope you're able to get outdoors for some point in the next couple of days. As I've been talking to staff, I've heard from people that in these video announcements, they do appreciate hearing the number of people in the Pathlight community who have tested positive for COVID-19, but they were concerned where if they had been exposed or what did it mean for them. So I want to talk a little bit about the notification process that we go through. When we are notified that a member of the Pathlight community has tested positive for COVID-19, we do have our nursing staff involved, primarily Miriam Kunta and Christy Marks. They work with the programs and with the departments of health to determine what the exposure period might have been and what the notification steps are. So if you have been exposed to a member of the Pathlight community who has tested positive for COVID-19, we will notify you. We'll notify you and we'll tell you what you need to do according to the Department of Public Health. Along those lines, I want to do a special shout out to our nurses at Pathlight. We are very lucky to have many nurses on our staff during this pandemic, which is a medical event. And in particular, we have 2 nurse practitioners, and a nurse practitioner is someone who's gotten their PhD in nursing, Miriam Kunta and Christy Marks. So they are very involved with all of our programs and with departments of health and have been helping keeping us up on the changing medical information that we are getting about this pandemic. So thank you to all of our nursing staff, but particularly to Miriam and to Christy. And in fact, Miriam was featured on a podcast recently. So I have included the link to that podcast so you can hear about her amazing career. She started out as a direct care professional and took her nursing career up to the PhD level. Because of that, I like to call her Dr. K. But it's a very inspiring story from a wonderful colleague. So take a listen. I've also heard about face masks and cloth coverings from people, like, why do we need to wear them? And I have a friend here to help with this discussion. This is our coyote from Brookdale Drive. This coyote is not very good about keeping the Canadian geese away, but he or she does really rock a face mask. Face masks are required because we are learning that there are more and more people who are carrying the coronavirus or who have it but don't have any symptoms, so they don't know. So DDS has come out with guidance that in our residential homes, face masks are required, cloth masks or other face coverings. And you're seeing in many communities, they are now requiring that face coverings be used when people are out in public, particularly in places where they cannot practice social distancing. So I think we're going to be seeing more and more of that. In mid-March, I think we're heading into our 7th week of this, we put in a number of practices, and we had said we'll keep those in place until May 4th, which is when Governor Baker has said the state of emergency will be in place until May 4th. It's clear we're going to need to continue this beyond May 4th. And so we're going to be continuing the practices we're doing now through June 6th. And what those are remote work in as many situations as we can, having skeletal staff at the office, having people sign in and take their temperatures, no home visits, by our family services and family-based living staff. They're checking in with folks via telephone and video chats. We are not offering classes at the Inclusive Community Center, but those amazing teachers have been developing a lot of online classes and activities for people that they're also offering to folks living in our care provider homes and residential homes. We've been getting a lot of positive feedback from parents who have their kids at home about our online classes and activities. We are also, day programs are still closed. So care providers and our residential group homes, and you're creating activities for people and keeping people engaged from 9 to 3, trying to help them from missing their friends too much. And in our residential homes, we still have a no visitor policy. We're checking people's symptoms and temperatures when they start their shift. And we actually have many homes that are on extended stays where staff are living in the homes for 1, 2, or 3 weeks, again, to minimize exposure. We are also going to be extending the temporary extra care bonus that we are giving to staff, nurses, and managers who are providing direct, face-to-face direct care. That will be also continuing through June 6th. So we are continuing to monitor what's happening and getting direction from our funders, but I did want to let folks know where we are on that timing. And lastly, I wanted to wish a happy Ramadan to the members of the Pathlight community that have started celebrating this week and will be for the next month. So Pathlight community, staff, nurses, managers, care providers, leaders, families, individuals, you all are amazing. You're doing a great job. And you know what? We need to do more. We need to double what you're doing. Hang in there. We are in the surge. And what is amazing is that our local hospitals, they're doing okay. They are not overwhelmed. And a lot of that is because of what the community's doing, what the hospitals are doing, and what you are doing. We are keeping our individuals healthy and safe. You're keeping yourselves healthy and safe and your families, and that is keeping our healthcare system from being overwhelmed. Thank you. Keep it up, keep it up for the next few weeks. It's so important. So be well, stay strong, keep up the good work. And I have a friend here for the next piece. Wash your hands.